So migraines are neurological events that are characterized predominantly by headache, but also by other symptoms such as nausea, sensitivity to lights, noises, movement, and so on. About a quarter of people who get migraines also get an aura, and that's a period of neurological dysfunction that usually comes before the headache, and it typically consists of a visual disturbance. So a flashing light and a blind spot that may move or grow in vision, usually over about 15 to 30 minutes before disappearing, and then people get the headache afterwards. So for most people, migraine aura is visual, consisting of a glowing dot or zigzags that may start in the middle of vision and expand outwards, or from the outside and come in or move across the vision, typically over about 15 to 30 minutes. Some people may get other forms of aura. These can be sensory, consisting of a slowly spreading numbness or tingling, often starting in the hand and spreading up into the face. Occasionally, people find that they can't get the right words out. They may experience vertigo or dizziness, or even in some cases, actual weakness down one side of the body, though those forms of migraine aura are very rare. Migraines aren't genetic. People are born with a predisposition to migraine, and about a quarter of those people will get aura. The aura processes happen on the surface of the brain. There's a little wave of overactivity followed by a period of underactivity that goes across the surface of the brain slowly and gives us the experience of the visual disturbance or the other things that can happen with aura. But the reason that people get it is that they've got genes that predispose them to it, that migraines may be triggered by things such as stress, lack of sleep, missing meals, and so on. But sometimes they will just come by themselves. So we have no treatments for the aura itself. There's nothing you can do about that other than to let it pass and just rest. The actual headache of migraine can be treated, and many people will respond to simple over-the-counter painkillers such as paracetamol or anti-inflammatories. There are more migraine-specific painkillers, the triptans, which can be prescribed, and these are often very effective. But they'll only work for the headache, the nausea, and those symptoms. The aura will just have to be allowed to pass by itself. Migraine with aura isn't dangerous. Auras can be very disconcerting and quite frightening, particularly if you don't really understand what's going on. They're your first ever aura, or they're different somehow from the ones that you've had in the past. Migraine itself is not a particularly large risk for stroke or heart disease, though it can be fed into calculations of people's risk. We know that having aura conveys a very tiny increased chance of stroke, but it's dwarfed by the risks associated with things such as smoking, high blood pressure, and so on. So the important thing, if you have migraine with aura, is to live a normal, healthy lifestyle. Make sure that you don't smoke, make sure you keep your blood pressure under control. And anything that migraines can do will melt into the background.